สวัสดีค่ะ Very good evening and welcome to Thai PBS World Tonight. I'm Nad Bunag.
I'm Tulip Nagsampoplau.
And today, Thailand recorded 31 new COVID-19 deaths, and this is the highest number since the pandemic started last year in the country. And if we only look at the newest outbreak since April, 182 people already died from the disease, while the national death toll is now 276. The Disease Control Department also reported 2,041 new COVID-19 infections, raising the total since early April to 42,162, and the cumulative total since last year is now 71,025. And currently, there are almost 30,000 people receiving treatment in hospitals. 981 of them are in critical condition, while 278 are on ventilators. So far, around 1 million people already received their first dose of the COVID-19 vaccine in Thailand, while around 380,000 people received their second dose. Meanwhile, Dr. Chawit Sannamwat, Acting Director of the Emergency Health and Disease Control Division of the Disease Control Department, explained that the high daily number of fatalities, which has frequently been the case since the outbreak of the third wave, stems from the surge of new infections and the increased severity of these symptoms. He also pointed out that after the closure of night spots in mid-April, more people have been staying at home, which has led to a substantial rise in infections among family members, from 27% to 54% of all the new cases. So to prevent the possible transmission of the disease between family members, he suggested that those who still work outside or in the offices should observe social distancing at home, wear face masks in the home, and eat separately from other family members. Meanwhile, the CCSA also listed the top 10 districts in Bangkok with the most infections, as so far around 13,000 people have been infected with the virus in the latest outbreak, and that is only in Bangkok. So what you're seeing right here, this is the top 10 districts with the highest number of COVID-19 infections. And what you may notice is that most of the districts that have the highest number are around the center of Bangkok, such as Hoi Kwang, Din Daeng, Bang Khen, Chatuchak, Lat Prao. These are the districts that have the highest number of infections in the latest outbreak.
And this brings the new attention to the densely populated area in Bangkok. And some of them are actually a slum area. And right now, another field hospital for Khlong Toey area, Khlong Toey district, is being planned. This field hospital will be accommodating COVID-19 patients from Khlong Toey slum area. And it will be an old building next to the Port Authority head offices as the first choice of location. And after conversion, the former warehouse will be able to accommodate 200 patients. Being an old structure, however, the warehouse may not be suitable, the authority said, due to the level of dust and poor ventilation. So Sapan Temple in Phrakanong district, adjacent to Khlong Toey, which can accommodate an additional 200 patients, will be the backup location. So the first 200-bed community isolation facility in Khlong Toey district was opened there last Friday to separate those infected with COVID-19 from others in their crowded community before being transferred to hospital. The plans for the field hospital came after the Ministry of Interior sent an urgent letter to the Port Authority of Thailand regarding the use of their warehouse. The director of the Port Authority, Sub-Lieutenant Kamonsak Promprayun, said that they will discuss the setting up of field hospitals with the Ministries of Transport, Interior, Public Health, and the Bangkok Metropolitan Administration. So right now, whatever we do or the government authority doing, they try to incorporate every related agencies together so things can get done quicker than it has been in the past several weeks.
Definitely. And in recent weeks, we've been hearing that patients have been concealing their timelines, and that has affected many of the medics. And so far, there are 8 Thai hospitals that have been temporarily closed after their medical personnel became infected with the virus or had to be quarantined because a number of patients, like we just said, concealed the facts about their infections. The first one is Masai Hospital in Chiang Rai province, which closed until May the 16th because 88 medics were quarantined. Another hospital is Chum Sang Hospital in Nakhon Sawan province, which is closed until May the 7th because one medic is infected with the virus. The third one is Ruam Phat Chainat Hospital 1 in Chainat province, which is closed until May the 12th because one medic is infected. Nong Muang Hospital in Lopburi province also closed until May the 14th because one employee was infected with the virus. And there's another one, Sam Pran Hospital in Nakhon Pathom province. The surgical ward of this hospital will be closed until May the 10th because 14 medics are quarantined. Bo Put Hospital on Samui Island in Surat Thani province is closed until May the 14th because 7 medics were quarantined. Pipun Hospital in Nakhon Si Thammarat Hospital is closed until tomorrow because 2 medics are infected. And Rathada Hospital in Trang province is closed until the end of this month because up to 34 medics were infected with the virus. So as we've been reporting that this is why we are not supposed to conceal our timelines. And no matter whether you travel to high-risk areas or you have been in close contact with those who've been infected with COVID-19, it is very important to reveal all of these details so that it is a lot easier for hospitals and other authorities to control the spread of COVID-19 because they will be able to trace where the virus is actually coming from.
And this does not just affect how our capability to treat COVID-19 patients. This also affect the capability of hospitals to care for other patients as well. Because when part of the hospital have to close down, like one of the hospitals, Sampran Hospital, have to close their surgery ward, or when half of the medical personnel have to be in quarantine, that's got to affect any other part of the hospital. Or if one hospital closed down, the one nearby in the neighborhood will be affected because they have to take care of more patients.
Right.
Now let's talk about vaccine. We have heard about, in Thailand, we have AstraZeneca, we have Sinovac, and then the Prime Minister was talking about Sputnik V of Russia. We had Johnson & Johnson, they already get approval from the FDA, and also Pfizer. And we heard about Pfizer, the Prime Minister was mentioning it. Now, we are talking about another one, which is Moderna from USA. Today, the Public Health Minister was discussing procurement or bringing in Moderna vaccine with the representative. And he said that Thailand will procure the Moderna COVID-19 vaccine through the Government Pharmaceutical Organization, or GPO, after the discussion with the representative. Moderna vaccine was developed in cooperation with the United States National Institute of Allergy and Infectious Diseases and the Biomedical Advanced Research and Development Authority. Thailand's Public Health Minister Anutin Charnvirakul said that the ministry is ready to support Moderna's registration with Thai FDA after the company submitted the necessary documents, which the FDA confirms are complete. The Moderna vaccine could be approved within this month. Moderna, however, said that the vaccine must be procured through governments or agencies under the government regulation only, meaning that cannot be purchased by the private sector directly. Sanutin said that the ministry will assign the GPO to import the vaccines for private companies which confirm the amount they wish to order. He reiterated that the GPO cannot just stock up on vaccines and wait for them to be purchased. The company can already order other vaccines as well that have been registered with the FDA already, namely AstraZeneca, Sinovac, and Johnson & Johnson. And there are also another 3 brands that waiting to be approved. Pfizer, Moderna, and Sputnik V.
Right. And there's also another research that came out today that a single dose of AstraZeneca vaccine could result in very high immunity levels in 4 weeks. So there's a study of 61 patients which shows that people who received the first dose of the AstraZeneca vaccine have achieved up to 96.7% immunity within a month, compared to those who had recovered from COVID-19 for a couple of months who have around 92.4% immunity. The study results were published by Dr. Yongpo Warawan, who's an expert virologist from Chulalongkorn University, and he posted this on his private Facebook page. So according to this study, female patients gain higher immunity than male patients, while those under 60 years old gain higher levels of immunity compared to those over 60 years old. However, for this study to be completed, there must be more information about patients who have received the second dose, which experts predict that it will keep their immunity very high. So this is just the prediction right now. Dr. Yong also said that based on this information, the immunity after only one dose of AstraZeneca vaccine is considered impressive. He also suggested that the inoculation process should cover as many people as possible, even with only one dose of vaccine. And he also added on this post that if 10 million people are inoculated each month, at least 30 million people would have the immunity against the disease within 3 months. So that is based on Thailand's top virologist, Dr. Yongpo Warawan, on the AstraZeneca vaccine.
So if one vaccine proven to be highly effective, like over 90%, I think the idea of Dr. Yong is very interesting.
Yes.
If we're able to cover as much as 30 million people within 3 months, and it sounds like we might be able to build herd immunity very soon, sooner than we expected.
Right.
And now come to another aspect of COVID-19. Since last year, when we heard the outbreak of COVID-19, all the insurance companies were very quick to come out with the COVID-19 policy. The popular one will be when you found to be infected, you get paid out by the insurance policy, and then it's all done. But now, due to the surge number of new infected cases, a lot of insurance company has canceled that kind of policy. So with the surge of cases, they have canceled this kind of policy that promised the payment upon the discovery of the infection. They have now been replaced by new products, which exclude medical personnel and cover medical treatments, comas, and allergic reactions to the COVID-19 vaccines instead, with an average of 2,000 new COVID-19 a day in recent weeks. The Thai General Insurance Association, or TGIA, said that the insurance providers may be liable for up to 1 billion baht in claims, as opposed to 200 million baht being claimed currently. So 20% of all infected people have made insurance claims since last year, higher than 10 to 15% reported in the first quarter of this year, thanks to the new COVID-19 wave, said TGIA president. Viriya Insurance has revoked its found paid done insurance from May 1st and launched a new program, which reduced protection coverage from 100,000 baht to tens of thousands baht. If you check right now, mostly will be 20,000 baht or 50,000 baht versus last year, it can cover as much as 100 or 200,000. So while increasing medical treatment, they reduce this payout, but they increase the medical treatment coverage in the hospitals in case of a lack of hospital beds, comas, and allergic reactions to the vaccination. Or if we talk about another insurance company, Sinmankong Insurance has suspended its 4 similar insurance programs since April 22nd, while Bangkok Insurance will suspend most of its COVID complete insurance offerings from today, except for the plan with the 259 baht premium. So if you're thinking about buying insurance policy, right now most of them will cover the treatment cost, and if you are in coma, and if you have to be in hospitals. But most of the policy that will pay out right when you found to be infected, most of them are canceled.
It's interesting how they use the strategy called found, paid, done. But because of the situation, they decided to cancel them.
I think it worked in advantage of the insurance company if the number of infected is not super high. But right now it's around 2,000 people a day, and they are in the high risk of paying out a lot of money here.
And now let's move on to another special report for today, because today we're going to talk about press freedom, right?
Yes, today is the World Press Freedom Day, and there's a lot of research, a lot of index that come out. One of the World Press Freedom Index is by the Reporters Without Borders, the French organization that give Thailand ranked at 137th out of 180 countries. So we are going to talk to the Thai academic on mass communication and also the chairman of the Thai Broadcast Journalists Association about the self-censorship and the freedom of press in Thailand. Let's take a look at the report.
เราต้องกลับมาตั้งคำถามตัวเองว่าข้อมูลที่เราถือในมือมันเพียงพอต่อการนำเสนอไหมถ้าเพียงพอต่อการนำเสนอมีหลักฐานอ้างอิงยืนยันได้ชัดไม่มีกฎหมายตรงไหนเอาชนะเราได้
A report by the Asia Democracy Network said the state of emergency, which the government uses to crack down on journalists or citizens to decrease freedom of expression, such as through internet memes, is common to 5 Southeast Asian countries, namely Cambodia, Indonesia, Malaysia, Philippines, and Thailand. This report coincides with the latest Press Freedom Index by French organization, Reporters Without Borders, which mentions that Thailand's cybersecurity law enacted in February 2019 gives the executive even more powers and poses an additional threat to online freedoms. Chairman of the Thai Broadcast Journalists Association, Pirawat Chothammo, agrees that although the cyber law only covers content published online, it also has an effect when it comes to the freedom to publish content in Thailand. But asked about media freedom, mass communications academic Dr. Jesada Salathong said that the government and the public must see such freedom as a check and balance tool.
The political sector or the government have to show their intention that they would like to see the media that can criticize or openly do their job, for the sake of the country's development. I think the perception of the government is really, really important. And then the perception of the business sector as well. If we can build up this kind of ideology that media freedom, it's not something that against your power. We have to think that check and balance is really important.
The legal clampdown on the media has led to some media outlets and journalists playing it safe through self-censorship. Press Freedom Index 2021 ranked Thailand 137th out of 180 countries around the world. The index said that the coverage, or lack of it, of the massive demonstrations in 2020 confirmed the scale of self-censorship within Thailand's formal media. On the other hand, Pirawat said it is not an issue of self-censorship, as he views it as being more about editorial judgment. He said journalists in Thailand have freedom and are not really restricted by laws, except for when it comes to the highly revered monarchy.
ในเรื่องเดียวคือเรื่องที่กระทบกับสิ่งที่เป็นสถาบันเบื้องสูงนอกนั้นจริงๆสื่อเล่นได้ทั้งหมดแต่ว่าคนที่เป็นการทำงานแบบสื่อมันต้องคิดว่าเมื่อนำเสนอไปแล้วเนี่ยผลกระทบในวงกว้างกับสิ่งที่นำเสนอขึ้นไปมันถูกชั่งน้ำหนักมันถูกสิ่งที่เราเรียกว่าระบบบรรณาธิการระบบบรรณาธิการในสื่อไทยถูกสื่อตอนตกมองว่าเป็น self-censorship.
Dr. Jesada said, however, that it is very risky for the media to censor themselves because the audience nowadays are more proactive. They have many sources of information and they can tell if something is up.
I think it's very difficult for the media who perform self-censorship right now because, well, right now we have to look at the audience that they are not passive like before anymore. The audience nowadays, they are very active, they are proactive. And when they, like smell something that, okay, this kind of information was censored.
Thailand is not the only Southeast Asian country in the bottom half of the Press Freedom Index. If you talked to journalists in the East, many would say the freedom in each country cannot be measured using the same criteria. While experts say that it is partly because of the differences in customs, cultures, and traditions of the East, it is also because the older generation of journalists are familiar with what was not mentioned or criticized rather than asking why.
เพราะฉะนั้นเนี่ยมาตรฐานของสื่อตะวันตกที่จำกัดคำนิยามคำว่าเสรีภาพเนี่ยขอบเขตบางครั้งมันกว้างมากแล้วอาจจะไปกระทบกับจารีตหรือว่าประเพณีนิยมหรือว่าความรู้สึกของด้านตะวันออกแต่ถามว่าถ้าถูกคำว่าจำกัดโดยกฎหมายไหมบางครั้งมีกฎหมายจำกัดในเรื่องสำคัญแต่บางครั้งไม่ได้มีกฎหมายจำกัดแต่เป็นความรู้สึกว่าเรื่องบางเรื่องเนี่ยมันเป็นเรื่องที่ทำกันอยู่เป็นปกติและบางเรื่องที่รับได้
It's fair enough to mention that all of these criteria were set by Western world, but at the same time I also think that this is a reflection. This is the mirror, like from at least Western world to look at us. Of course, I believe that in each country they have their own nature, they have their own context, which is different, like country by country.
For a country which seems to have more coup d'etats than other countries have elections, one thing that has not changed is self-censorship. Regularly, media outlets have to choose between being taken off air or broadcasting sanitized information. Media organizations are not forced to do so, but those who are more critical of administrations can see themselves quickly shut down, albeit temporarily. As always, this sends a sharp reminder to others in the industry to be aware. For Peter Watt, however, he said that if the evidence of what was published is solid, there is no law that can win over the truth. It has to be explicit, accurate, and clear enough to publish.
เราต้องกลับมาตั้งคำถามตัวเองว่าข้อมูลที่เราถือในมือมันเพียงพอต่อการนำเสนอไหมถ้าเพียงพอต่อการนำเสนอมีหลักฐานอ้างอิงยืนยันได้ชัดไม่มีกฎหมายตรงไหนเอาชนะเราได้หรอก
Going forward, could Thai media hold to the same standards as in the West if we talk about investment in time, human resources, and budget in investigative and in-depth content? Peter Watt said, "Don't ask whether we could be, but whether we should be."
ใช้คำว่าควรดีกว่าควรต้องทำแต่ตอบว่ามันจะไปถึงขั้นนั้นได้ไหมแต่ว่าโดยหน้าที่สื่อควรต้องทำให้ถึงขั้นนั้น
So going forward, ideally, we would hope that the Thai media will be able to go up to the same kind of standard in terms of investment in human resources, in the money, budget, and time when they do investigative piece. Right now, to be honest, I think Thai media is strapped with the idea of having to get the news out fast because of the world of the internet.
Definitely, because we're in the social media age where we are so interested in getting all the information as soon as possible. It highly affects the accuracy and especially during COVID-19 when we all want to present the numbers, the figures, and all the information as soon as possible. It's not just only the accuracy, but the fact that there is also a big rise in the number of fake news and misinformation. So it is definitely a big challenge for the Thai media to actually cope with the situation. And interestingly enough,
Another side of the story is the media literacy, though. I mean, along with this fake news. Another thing that we have to consider is media literacy of the people that consuming media. How much they know, how can they judge the story or the information. So it's also a job of education system in Thailand to educate people, to equip them with media literacy.
And it's interesting that the rankings for Thailand has been low for so many years, and people often blame the government, the censorship that has been going on for so many years. But we have to admit one thing, that because of social media and people are becoming more aware, and with the help of different news channels, people seem to have more access to different information, not just only from the traditional media.
Yes, and because there's so many resources of the information, there's so many sources for the information they can find by just Googling things, they can smell it if there's something is up, if something has been censored.
Definitely.
And that's all the news we have in this edition of Thai PBS World Tonight, but you can check out our website, worldwideweb.thaipbsworld.com, for more news, things that happen in Thailand, and anything that I think it's a lot. We have a lot of interesting stories, in-depth analysis, profile of interesting people, or explainer of what's going on in Thailand and sometime in ASEAN region as well. We also have exclusive report from Myanmar.
And that wraps up tonight's edition of Thai PBS World Tonight. Thanks for watching, and we'll see you tomorrow. สวัสดีค่ะ
สวัสดีค่ะ